Thank you for joining us for this month's webinar. Our topic is cancer awareness, and our presenter is Jessica Reynolds, and she is an RN and a health coach with Strategic Health Services. Jessica?
Hi, Dawn. Thanks. Howdy, everyone. My name is Jessica. I'm a nurse for 25 years. My background is ICU emergency medicine. I've always looked at my patients in a critical life event and wondered, what if they had had the opportunity to have someone to talk to them, to help them make lifestyle changes? Would it have helped? And just as importantly, reminded them of their recommended screenings. Can it make a difference? So here I am to do just that. So again, thank you for joining me this morning. We're going to talk a little bit about cancer awareness. And a quote comes to mind from James Thurber, and it says, let us not look back in anger nor forward in fear, but around us in awareness. And again, when it comes to cancer, awareness and prevention is certainly the key. There's 5 key messages that we want to convey today, but again, most cancers can be prevented. Screening can reduce death. And again, the recommendations on those screenings are typically based on age, family history, and we'll talk a little bit more about that as we get going here. And again, it's important to note that some people have a higher risk for certain types of cancers, and those individuals may need to begin screening a little bit earlier. And again, there's so many different screening options available. Again, the most important thing to think of is if you should be screened, do not put it off. And again, let's start with colorectal cancer. And again, I stayed with last year's estimations because that has already occurred. So again, in 2014, about 140,000 new cases of colon cancer, rectal cancer were diagnosed. And of those, 50,000 people died. And this is one of those cancers that both men and women are at risk. And again, all races are equally at risk here as well. As with the screening, again, back to the prevention and early detection is the key here. And, on the prevention side, that's like removing a polyp that could turn into a cancerous lesion. Early detection by having a screening test done is so important to decrease your risk of the cancer death. You got to talk to your healthcare provider about your risk factors. Again, family or genetic disposition is a strong screening tool for most cancers. It's a good idea to make sure you take the time and have a part of your health history, which, if any family members have actually had a certain type of cancer. And again, the more immediate the relative is, the higher the risk is generally. So again, know your personal history of colorectal cancer, polyps, your family history. Do you have an inflammatory bowel disease, Crohn's, irritable bowel? And again, are there signs and symptoms? Do you have some rectal bleeding? Do you have an iron deficiency anemia? Lots of different screening methods. The fecal occult blood test, or the FOBT, yearly. Again, the screening, when do you need to start that? It starts at age 50, and there is an ending date, and that would be 75. And again, folks with a higher risk must screen a little sooner. The fecal occult blood test is just checking for hidden blood in your stool. You need 3 consecutive stools on 3 consecutive days. So if you're having loose stools or diarrhea, you should postpone until your stools are a little bit more regular. The reason behind this is that colon cancers, they can bleed intermittently and not necessarily constantly. So again, before you do the blood test, your healthcare provider will ask you also to follow a special diet for 48 to 72 hours before the stool test is done. In general, this is going to be like no beets or radishes, broccoli, red meat, especially if you like your red meat on the raw side, and avoiding high vitamin C as well. But again, your doctor will give you a list of those common things before you take the stool sample, because again, many things can cause microscopic blood in your stool, internal or external hemorrhoids, polyps, ulcers, diverticulitis. The key is to find something that could be worrisome at the earliest possible time. The flexible sigmoidoscopy, that's the test with the flexible tube with a light that they used primarily just to take a look at your rectum and your colon. This can actually be a very effective screening tool, especially combining it with the fecal occult blood test. And of course, the colonoscopy, everyone's most favorite screening test. This test actually uses the lighted tube, and they can look at your entire colon with this one. And also, they can actually take tissue samples for a better look if they run across any suspicious areas of tissue. And while they're in there, they can also remove the polyp or do a biopsy during the exam. And again, the colonoscopy is used diagnostically with symptoms or to follow up positive results with other screenings. Ways to help yourself in preventing colorectal cancer. You know, exercise. Exercise for many different reasons, but for decreased weight as well as hormone regulation. Diets that are high in red meats, processed foods, hot dogs, popular lunch meats can increase your colorectal cancer risks. Vegetables, fruits, whole grains, they decrease your risk. Heavy alcohol smoking, it increases your risks. And as for thoughts that the jury is still out on, a lot of talk about aspirin and NSAIDs, NSAIDs being non-steroidal anti-inflammatories. According to WebMD right now, aspirin may stop cancer cells from multiplying, and NSAIDs may reduce the size of the actual polyps, therefore decrease the risk of colon cancer. However, it is important to note that, you know, they don't know about the doses or the other side effects such as gastric bleeding. These may far outweigh any possible prevention theories. So again, these are just some studies that are kind of ongoing for the future. On to women's health. We'll talk a little bit about breast and ovarian cancers. Breast cancer. All women are at risk. The National Institute of Health recent guidelines say that 40, that is the starting age for mammograms, if you're about average risk for breast cancer. And then you should have a mammogram every 1 to 2 years after you have started. If you're at a higher risk, you will need to have the discussion with your physician. Do you need to start before the age of 40? And if so, how often should you have them? High risk, that means have you personally had breast cancer or have lab tests shown you to have the genetic tendency, which would be BRCA1 or 2. And lastly, what is your family history of breast cancer? So many women in the past, you've been comfortable starting your mammogram at the age of about 50, but since the early 1990s, the studies have actually proven that starting at 40, this mammograms have reduced cancer by 17%. So, you know, again, talk with your doctor to determine that right screening timeline for you. Breast cancer self-exam, or the BSE. It is an option for women starting at about 20. Again, women need to know their breasts. The Susan G. Komen Breast Cancer Awareness recommends that a clinical breast exam be done every 3 years, starting at the age of 20 and every year at the age of 40. The self-breast exams have become controversial as it it hasn't really been shown whether or not it actually saves lives. And this comes from the USPSTF, which is the United States Prevention Services Task Force. Again, I must stress here and remind you that preventative screenings are done before there are any symptoms. And once the symptoms are actually found, then the testing becomes diagnostic. So there's the difference. So again, you have to know your breasts. Any lumps, dimpling, nipple discharge, pain in that just one certain spot, which includes the armpit areas, you have to report these immediately. And again, this goes for men. Not only women get breast cancer, but again, the number for men is going to be significantly smaller. Ovarian cancer. It is the 5th most common cancer death in women, and detection is the key in surviving this one. And unfortunately, with the ovarian cancer, the exact cause is unknown. So how do you know? What are you looking for here? Unfortunately, with this, the symptoms can be a million different things. Abdominal pressure, swelling, bloating, fullness, you know, a little weight gain, a little weight loss, a little vaginal bleeding. Again, this type of cancer is very difficult to diagnose. So when you're having any lower pelvic changes, again, write your symptoms down and also what may have exacerbated them. What were you doing when you had these symptoms, and report directly to your physician. Again, because there is no good screening for ovarian cancer. And given the difficulty to detect this cancer, there is a difference of opinion among the experts on how to best protect women in general. So always have a discussion with your healthcare provider and discuss what is best for you. Cervical cancer. What is it? What things do you kind of need to know about that? At least for the cervical cancer, there's an effective screening exam, and it's called the Pap smear. And what that is, it's just a simple test when a few cervical cells are actually examined under a microscope to detect any abnormal cells. We get these routine Pap screening exams to see if there's any precancerous or even cancer cells present. Again, recommendation, women's first Pap smear, you start at the age of 21 and every 3 years after that until the age of 65. 65 with adequate and routine screenings is the recommended stopping point. Also, another stopping point is post-hysterectomy when the cervix has been completely removed. Prevention. You know, again, you have to do your regular exams. Maybe with the female cancers, a low-fat diet may decrease your risk. And again, if you're genetically predispositioned, make sure you have that conversation with your doctor about what to do next. Men's health. We'll talk a little bit about prostate and testicular cancer. Prostate. Again, the prostate is the actual gland that is part of the male reproductive system. In about 233 new cases last year. It is the second leading cause of cancer death in men. Men, you need to have the opportunity to make an informed decision about whether or not to actually be screened for prostate cancer. There's two things that you need to know. One, what are my risks? Two, what are the benefits to the screening? And also, starting at what age do I have the discussion with my doctor? 50. Unless, of course, you're at a higher risk, and then it's 40. What's high risk? This would include having a relative with the prostate cancer. So then that, again, puts you in the higher risk category. Okay, so you've made the decision to actually screen. Few ways to start. The doctor may do a digital rectal exam and a PSA lab test. Generally, if your PSA is less than 2.5, retest every 2 years. If your PSA is greater than 2.5, then he may ask you to test yearly. Again, prostate cancer is often a very slow-growing cancer. If your life expectancy is not expected to be another 10 years, then of course there's no testing even recommended. What are my risk factors? Age, race, family history, diet, and actually obesity for men's cancers does play a part. Diagnosis. Again, that abnormal digital rectal exam done by your physician, the elevated PSA test. If those two come back positive, they again may opt to do an ultrasound of the area and then maybe a biopsy at that point. Testicular cancer. You can get testicular cancer in either one or both testicles. The average age at the time of diagnosis is about 33. And again, in 2014, almost 9,000 new cases were diagnosed. And again, the testicular cancer is the most common cancer among young males under 34. It is most commonly found by accident, either by yourself or your partner. With this cancer, there's no real evidence that screening or self-exam can detect testicular cancer at an earlier stage. So again, anything unusual in the testicular area needs to be followed up in a pretty timely manner with your doc. Signs and symptoms. And, a lump, maybe some swelling, pressure, fullness, achiness. And again, with testicular cancer, there could be no symptoms whatsoever. For the diagnosis, again, we've talked about the exams, but on the blood test tumor markers simplistically are proteins produced by cancer cells. They can also be released by non-cancerous cells, but some actually can be measured by a blood draw. For example, like the CA-125, it's a blood tumor marker for ovarian cancer. The PSA is a blood tumor marker for prostate cancer. So elevated levels may tell us the presence of tumors, but the blood markers are always usually combined with other tests to diagnose. Skin cancer. This, of course, excuse me, is the most common cancer in the United States. It mostly appears after the age of 50, so by then we've had lots of time to do some damage. Remember, skin is our largest organ. It is meant to protect us, so we must protect it. The definition of skin cancer is just simply the uncontrolled growth of abnormal cells, and again, usually caused by damage to the skin by ultraviolet radiation. Who's at risk? Mostly light skin color. Your fair-skinned folks, red hair color, blue eye color, freckles. Again, you have genetics, certain types of moles, long-term sun exposure. And again, the studies are showing more and more what is your history of childhood sunburns and the severity of them before the age of 18. Types of skin cancer, there's the precancerous actinic keratosis, and then there's the cancerous squamous and basal cell carcinomas, as well as melanoma. The actinic keratosis, that's that precancerous condition, and again, it's kind of a thick, scaly patch kind of on sun-damaged areas of skin. And again, what to know about this is this can very well lead to the squamous cell skin cancer. Squamous cell, again, it's similar to basal cell in that they grow in areas on your skin that have the most exposure to the sun. Your nose, your ears, men, your bald heads. And again, the thing about squamous cell it is more rapid growing than basal. So again, a couple of ugly little pictures, but if you'll notice, in all three of these pictures, it's above the neck. It's cheek, ear area, head. So again, those areas that are very much sun exposed. And my screen will go here. We'll get to the next one. Whoops, a little bit too quick there. As for the basal cell warning signs, again, they look a little different than the squamous. These are small, smooth, maybe a waxy or shiny. It's kind of, you know, they're very hard to describe. They can be a firm red lump, or even a little lump that kind of bleeds, or you notice is kind of crusted over. So anytime you have abnormal, like little skin things, you know, make sure you bring that up with your doctor. As for moles, it's a little different. You know, obviously the gal with the mole on the side of her lip is a very common sign, and it looks very much different from what an apparent melanoma looks like. Melanoma is the skin cancer that's mostly associated with the mole or mole changes. Some warning signs can be some itching type pain or even bleeding at the side of a mole. Your healthcare provider teaches kind of an easy way to watch, so to speak, your moles. You can think of the ABCD here for the moles. A is for asymmetric, well, if I could say the word, abnormal borders. Is it round? What color is it? Melanoma can be black, brown, red, or white. The important thing is has the color changed? D for diameter, is it the size of a pea? Again, you have to know your moles. You got to know your skin. Alert your provider for any changes. Again, skin cancer is the #1 type of cancer. How's it found? You know, again, we have a tendency to kind of look at our skin. And again, you got to go to your doctor's visits. Early detection is the key here. So checking for cancer when no symptoms, again, before the symptoms come up, it's called the screening. So, you know, when you ask your healthcare provider to check your skin, you're going to find many different and non-dangerous skin conditions present. Even experienced physicians can accurately pinpoint abnormalities, especially in older folks. But again, if anything is found that is concerning, that should be followed up with a dermatologist. And again, if you do find something, don't pick at it or shave it off or burn it off. Any weird or suspicious area needs to be left alone, because again, the dermatologist needs to study the area and then take his own skin sample at that point. Again, in summary, you got to get your recommended screenings, have your informed discussions with your doctor, know your risks, and no good health coach would end a webinar without throwing in a dash of nutrition and exercise. According to the American Cancer Society, poor diet and not being active increases your cancer risk. That easy. Poor diet and being overweight causes the body to make more estrogen, more insulin. Both of these are hormones that can stimulate cancer growth. As for activity, it helps keep the weight down, also improves your hormone levels and keeps your immune system operating more effectively. Avoid processed foods. If you can't read or pronounce the ingredients or it has a commercial, time to decrease it. You got to eat your vegetables, all kinds of them. The more colors a day, the more benefits you're getting. Don't make it hard. Just kind of have fun. Throw a ton of stuff in your grocery basket and cook it at home. And for improved everything, you have got to step away from the tobacco. Again, thank you all so much for your time today. Have a great week. We as coaches with Strategic Health Services, we're here to help remind you of your recommended screening guidelines for that and any other health goals. Just let us help you with your journey. Thanks again.